So good afternoon, everyone, and welcome to Member Cafe. I'm gonna turn the mic over to Seisha Bonner today. She is going to be facilitating for us. We're going to wait just a few moments while we watch our numbers tick up, and then Seisha is going to take it away.
Thank you, Anne. Okay, I think we are, I see the participants are coming in, so maybe 1 or 2 more minutes and then we can start. Okay, I want to welcome everybody to our Member Cafe. My name is Seisha Bonner. I am a part of the member engagement team here at Partners. Thank you for joining us. Greatly appreciate your attendance and spending your Tuesday afternoon with us. Today's topic will be the impact of smoking and vaping on your health. Joining me today as our facilitators are Terry Christie, we like to call her our tech guru, and we have Stacy Lawrence, who will be entering information into the chat that you will need to obtain additional information if you have any questions, as well as resources. We also have Ann Glove, who will moderate your questions at the end. Joining us on our panel today, we have Virginia Fag Crespin, we have Shelby Holland, and we have Delton Russell. Virginia is a substance use prevention and education program coordinator, behavioral health at the Behavioral Health Department for Cabarrus Health Alliance. She is going to be here to share information on the health impact of smoking and vaping, tobacco and other products. Also, we have Delton, who is part of our Partners family here. He works with population health. He's our recovery specialist. He will share information on Partners programs. And last but definitely not least, we have Shelby Holland, our tribal liaison, presenting on Native American communities and spiritual impact of smoking ritual and pipe ceremonies. So today we are offering today's session in closed caption. If you don't need this feature, at the bottom of your screen, you can simply hover over the live transcript and click Hide Subtitle. For those of you who are new to Partners, we are a managed care organization for North Carolina Medicaid and other state-funded services and behavioral health services, mental health, substance use, IED, and TBI. At the end of today's session, I will share a little more information about Partners and our member engagement team, in which, I don't know if I mentioned, I am a member of. But before I introduce our guest speakers and give you some more information on Partners, I want to make sure that you know that the meeting is being recorded. And please do not share any sensitive personal information during the call, as again, it will be recorded and live for people to see. Partner staff is available after this call for individual issues you may want to discuss. We can also schedule a time to talk to you one-on-one. The recording and PowerPoint slides will be available on our website at www.partnersbhm.org under the Member Education tab. Please feel free to put questions into the Q&A as we go through the information, and we will moderate. When I say we, I mean Ann, will moderate all your answers and your questions at the end. You can also raise your hand and we can open your mic and speak. You can speak directly to us. Okay. Partners Health Management. Partners Health Management is an insurance company. Oh, there you go. Can you guys see the screen? Perfect. You can go to the next slide, please. So Partners Health Management, our goal is to improve lives and strengthen communities by focusing on positive outcomes for our members. We are a managed care organization. We manage health plans, I would say insurance plans for North Carolina, Medicaid and state-funded services. We manage a network of providers that specialize in treating your needs in reference to mental health, substance use, or intellectual and developmental disabilities, as well as traumatic brain injury. You won't actually come physically into partners to obtain these services. Instead, we make sure those who need the treatment can get the treatment through our network of providers who are contracted with us. Partner currently manages the Medicaid Direct, 1915I, and state-funded services. One of our big and important items that we do offer is a crisis call center, and it is 24 hours a day, 7 days a week for behavioral health crisis or behavioral health concerns in reference to mental health and substance use. Or we also have a mobile crisis. If the need is that significant, we can go ahead and connect with mobile crisis to ensure member safety. Next slide, please. As I said prior to, these are our counties that we serve. We have 14 counties in North Carolina that we manage Medicaid funds and services for. Now let's talk a little bit about Medicaid expansion in North Carolina. I'm not quite sure if you guys have heard, but it has been a big topic going on, and it's a great topic. North Carolina has expanded Medicaid, so starting December 1st, approximately 600,000 more North Carolinians will be eligible for Medicaid based on their age and income. So with that being said, there are going to be different qualifications that one can, that will change, that have changed in income or, whatever circumstances you might have. You or someone that you know may be eligible for Medicaid. Medicaid will now cover people ages 19 through 64, and as I said before, with higher incomes. We'll put the link in a flyer of the chat so you can see how you can look and see the new income requirements and see where you fall into it. As I said before, you or someone you may know may be able to get healthcare coverage through Medicaid, even if they didn't qualify previously. The one thing that has remained the same is that you must be a North Carolina resident or a non-citizen with qualified immigrant status. So there are four ways that you can apply for Medicaid. There's the e-pass, which is the online option. We have the paper application, in-person application, as well as you can contact your local DSS office. So with the in-person application, you will need to go into your local DSS office to request that as well. With that flyer I just spoke about, it will have links, and feel free to give us a call here at Member Engagement as we can help assist you with these options. Again, that's the e-pass option, that's the paper option, and that's the in-person and telephone option. Now, I want to say, because this is one question that we do get a lot, the application process can take up to 45 days. But once you are approved, you will get the confirmation and your choice. You'll be able to make your choice of your healthcare plan with Medicaid. I want you to know as well, if you are not eligible still for Medicaid, there are still ways that you can receive insurance and coverage through the Affordable Care Act, and that's visiting the marketplace at healthcare.gov. Now let's talk a little bit about 1915I. 1915I is a state plan amendment. It gives North Carolina Medicaid the opportunity to extend services to more people who are in need. The eligibility for the 1915I services are not as rigid, as well as, I would say, difficult as it was before. It does require a person to meet, it does not require a person to meet ICF or IDD level of care, so more people can be supported. B3 services can be different depending on your MCO. The I in services are the same. The 1915I services are the same across state lines. I mean, I'm sorry, within state lines, so across county lines. So anywhere in North Carolina, if you're receiving them, you will be able to receive them at any county. If you currently have B3 services, you will soon be transitioned over to the 1915I services if you haven't already. You shouldn't see any difference in service delivery. If you have any questions regarding the transition or assessing 1915I, contact your care manager. So there are ways that you can have access to 1959 services. I'm going to go over them a little bit with you. As I said before, your point of contact will be your care manager. A care manager will complete an independent assessment, and they will submit it to the state. Now, this assessment is not as long as previous assessments. I would say it would take maybe around 15 minutes. The state conducts the independent evaluation for the 1915I eligibility. Then the letter will be sent to the member regarding eligibility. Your next step is that care manager, and I want to put emphasis on that care manager. The care manager is the driver of the implementation of the plan, or the development of the plan, of your care plan. Your care manager will submit completed care plan ISP for prior authorization. Then next, your care manager follows up with identified provider agencies for the service that you have identified as the need. And that's also based upon the assessments that have been completed. So 1959 benefits, they support individuals with Medicaid, IDD, TBI, serious mental illness, including severe and persistent mental illness, serious emotional disturbance, severe substance use disorder, and it's for the age of 3 and older who have Medicaid. Some of the services that you can obtain would be that respite service, which is rest and relief for caregivers, supported employment, community living and supports, independent living, independent living skill building, financial supports, you will be supported all around in the community. Services in the home to maintain living in the community as well. So there's a plethora of services with the 1915I. So I'm pretty sure you all have listened to my voice for a very long time. So the next voice that you will hear will be Virginia Fagg-Crespin, and she will go over some information in reference to substance use.
Thank you, Seisha.
You're more than welcome.
Hi, I am Virginia Fagg-Crespin. I am the Substance Use Prevention and Education Program Coordinator at Cabarrus Health Alliance. And I am here to talk about tobacco prevention and cessation, or quitting. It's a fun word to say. So our goals for today are that we can familiarize you with current drug trends and in both adults and adolescents, what they're being exposed to in the community, and then provide some education and resources, whether they're local resources or also virtual resources, help you boost your skills in prevention and intervention, identify ways to support other people. Maybe you're not the person that has an issue with nicotine, but spouses, children, especially young adults, we're seeing an increase in that. So helping you identify ways to support other people in an effort to quit. And then, like I said, also to provide community resources. Next slide. So, okay, pretend like you can't see this, but so what percentage, and you guys can put this in the chat or you can say it out loud, you can unmute and say it. What percentage of adults do you think begin smoking before the age of 18, of adults that smoke? Do you think it's 40%, 60%, or 95%?
%60.
60. Okay. Anybody else?
All right, we have some folks from the audience.
Oh,
Let's
here
see,
we
we
go.
have one at 35%. We have one at 95%.
So yeah, 95%. And why do you think that is, Jerry? Put you on the spot, sorry. Okay, what do you think the impact is on adolescents?
Yeah, so Jerry's muted,
Oh, okay.
but we can certainly unmute him, I guess, if
Jerry. That's fine. So the answer is 95%, and I'll give you the answer. The answer is that nicotine is a highly addictive chemical, right? And our brains are still developing until what age? Does anybody know? Roughly like 25 to 27. Oh, I heard a beep. Oh dear, Jerry, I know. It's okay. Mid-20s, correct, Jerry. Good job. So mid-20s, right? So if we have adolescents that are starting to either smoke or vape, that is going to be part of how their brain matures, right? And how it forms. So I like to start locally and like move out. So in 2022, 1 out of every 30 Cabarrus County middle school students, that's 3%, reported that they had used e-cigarettes or vapes in the last 30 days. And 1 out of every 7 high school students reported that they had used an e-cigarette or a vape in the last 30 days. So I think that right there, while when we look at something like 3%, that sounds small, but when you look at 1 out of every 30, which is basically 1 in every classroom, that I think is pretty significant to local data when you're thinking about middle school students. Can you hit enter, Sasha? Okay, so in North Carolina, the most common source of e-cigarettes among youth aged 13 to 17 in North Carolina is from a friend who currently is under the age of 21. In North Carolina, we are one of only 9 states that have not raised the minimum tobacco purchase age to 21 years yet. And we are one of only 10 states that don't require tobacco retailers to obtain a permit or license. So in our efforts to pass that, we're definitely looking at, ideally, we would have a permit or licensure requirement for anyone who is going to be a tobacco retailer. And by tobacco, we mean like anyone who's going to sell vapes, cigarettes, cigars, cigarillos, that kind of thing. Okay, can you hit enter again, Sasha? Thank you. So here's your stat. The national data shows that about 95% of adults who smoke began smoking before they turned 21. And then e-cigarettes or vapes have been the most commonly used tobacco product in youth since 2014. So that's almost 10 years that we have had where students are using more and more, and it's becoming more and more accessible. Next slide, please. All right, so what motivates us to use tobacco products? What do you think most people say? Most people are going to say stress relief, boredom, in a social situation, pressure, like if other people are, then they will, right? And then maybe they're addicted. Maybe they just they know that they are. And but a lot of people are going to say that misconception that it's safer to, vaping is safer than smoking, and then to relax, or they like the flavors. A lot of our adolescents are reporting that they like the flavors. They use it for social reasons and for boredom. So we're trying to get ahead of that, right? And then with stress in the tobacco cycle, you can see here. So people think that smoking is a stress reliever, when in reality, nicotine is. Does anybody know? Is it a depressant or no? Okay, so nicotine is only going to create essentially more anxiety. It is why am I blanking on this word?
Stimulant.
Stimulant. Thank you, Dalton. Thank you. I was like, God. So in the event that someone decided to quit smoking, what kind of symptoms do you think that they would experience? What kind of withdrawal symptoms?
So in the chat, we have anxiety, irritability, can't concentrate,
Yes, exactly.
nervousness.
Maybe trouble sleeping. Yeah. Hard time concentrating. Yeah. So when we're looking at adolescents and they're trying to quit, maybe they were vaping all summer and then school starts back. Right. So then they have this new environment. That's now regulated. They're not able to vape on a regular basis. So maybe they have a hard time concentrating, and they're just like constantly craving that nicotine, that fix. They feelings of depression, anxiety, restlessness, inability to kind of sit still, like in that sense. So yeah, so those are all, I think, the drawbacks that nobody wants. Increase in appetite too, I think, is a big one for people that have been smoking for a long time. They think, oh, I'm going to gain weight, which could or could not be the case, but it definitely has to do with the way in which you choose to quit. So let's talk about next slide, please. So teen substance use reports are holding steady. If you look at over the last 3 years, we can see that it's hard to see in the way it's kind of overlapping here, but you've got 8th grade is the pink line, 10th grade is the gray black line, and then 12th grade is the green line. And so you're not seeing a whole lot of change and over the last 3 years. I think a lot of that has to do with the pandemic, that some of this data might be great, some of it might be just okay, but I think it's important for us to all realize that we are looking at a substantial amount of usage in middle schools and high schools. And that's really where this is starting. And as we know, based on the statistic initially, that most people that are become addicted have started using nicotine, some nicotine product, before they're 21 and usually before they're 18. So if you'll go to the next slide. This also just shows you usage trends, and you're looking at North Carolina as a whole, as well as Cabarrus County. So if you look at these numbers, you can see that Cabarrus County, while we are below the state numbers, we're still talking about like a significant amount of usage for adolescents. Next slide. So key recommendation for adolescents is to talk early and often, right? So so many parents come and say, oh God, this is so uncomfortable. We don't want to have this conversation. Yes, but what's really uncomfortable is when your kid maybe gets suspended. That's a very uncomfortable conversation. or when you find out that your child has been vaping for a year, and that's an uncomfortable conversation because now they're sick or something like that. So we just really try to encourage you to speak about these uncomfortable things as much as you can. And maybe instead of an hour-long conversation once, maybe have 6 10-minute conversations. And then that way you're not necessarily cornering them, but the car is a great place to have these conversations, right? Because they can't get out. But then also just making sure that you are talking about like the positive things that, in fact, while we do see that maybe 10% of students are, that is a substantial number, it's also, there's 90% that aren't, vaping. So keeping those numbers in balance and making sure that your child or whoever it is that you're talking to is aware. And then also working with them for positive coping strategies, right? So coming up with alternative activities to vaping, smoking, whether it's trying to figure out what they used to love doing, maybe when they were 10, go ride a bike. Well, let's go ride a bike, or journaling or listening to music, and just helping them. If it's an adolescent that you're working with, helping them to kind of engage in other activities is always helpful. Here are some, if you go to the next slide, some substance use conversation starters for adolescents. If you're interested, then I think these are good. They're kind of open-ended and helps sort of start that conversation with a child, whether they're 11 or 17, finding those like age appropriate. And there'll be some resources at the end as well that help with that. Next slide. Okay, so when we look at the current trends, we're looking at disposable products. They are the iPhone 14, 15 now, right? So I made this a couple months ago of vapes. And so looking at just, the cost, like monetary cost versus how many puffs you're getting. And these are sort of like the new, like, fad, and they will change. The brand will change every quarter, every 6 months or so, and the kids are very quick to tell you what's in vogue. If you go to, I always encourage parents to go to a vape store and educate yourself, ask questions, because the owners and the people that are working there, they will tell you. They are very honest, and they'll tell you exactly what kids are buying, what to be on the lookout for, what looks like a marker. Because a lot of vapes, as y'all probably know, they don't look like something that kids would be smoking. So being aware of that. And then next slide. So when it comes to adults or adolescents, but specifically adults, there is an opportunity for nicotine replacement therapy. And so how it works is it replaces the nicotine that you would normally get from a tobacco product with something safe, like either a patch, a gum, or a lozenge. And I think a lot of times that people think, oh, well, it's just gum. It's just going to be like a momentary thing. But it's not. It's actually proven to actually help you quit long term. And so getting your nicotine from a patch, gum, or lozenge is a lot safer than smoking, right? So because otherwise, anytime you're inhaling something with a heating source, that's affecting your lungs. So anybody can make any claim they want to about that vaping is it's not proven that it's worse than cigarettes, but if you are inhaling something that is heated, that's obviously very bad for your lungs. And so this is an alternative. And I think it's important to note something that I recently learned in a training, that, for example, the gum and the lozenge they are created. Can you go to the next slide? Thanks. To to help you, but the gum is not like a chewing gum, right? So you're supposed to chew it. And here we have some explanation. So you slowly chew it until you notice a taste. And it's almost like a dip. You're supposed to keep it in your cheek, and that will help you absorb that nicotine. And then essentially they ask you to spit so that you don't digest that. Don't drink any acidic beverages. And then the lozenges are similar. Again, you don't want to swallow them. You want to let kind of your mouth absorb that. And then the patch, again, you can choose kind of what location you want it to be in. They're very discreet. And I think, you have to be aware of the side effects of them. If you're having crazy dreams, then, talk to a doctor, maybe stop using them and look at other alternatives for that. Next slide, please. So this just has some information on the demographics for adults that are using vapes or e-cigarettes, and how much that's grown. Big Tobacco originally marketed this as a way to help you quit, but in fact, people are more addicted when they're using vapes, it seems like, than if they were actually smoking cigarettes. And then we're going to skip this next one and just go to some of these resources for prevention and treatment. The Quit Line, I would like to point out, is a great resource. If you are uninsured, they will provide you with 4 calls, and then 8 weeks worth of nicotine patches and gum or lozenges. If you have Medicare or Medicaid, you get 4 calls. If you have Medicare, you get 8 weeks of nicotine patches. And then if you have Medicaid, you get 2 weeks of nicotine patches and gum lozenges. But you have the potential to get 12 more weeks if you ask. And then commercially insured, you get a call, and then 2 weeks of nicotine patches or gum and lozenges. And you can quit. You can text that you are ready to 34191. And if you go to, these are all links. Are we sending this out, Anne? Everything, this will all be sent out?
Yes.
Okay, so those are live links. So if you click on any of these, it will take you to the prevention and education website for that. And then, so I just think it's really important. I think the Quit Line is a great resource for North Carolina, in that they provide not just like emotional support, and support for, if you have any sort of mental health issues, they are there. It's a free resource for you, and they're providing that nicotine replacement therapy as well. Let's see. And then, so the Truth Initiative, they're also working for prevention and early intervention. That Carolina demography, that's going to give you some North Carolina statistics. The Tobacco 21 website will show you just exactly how each state measures up as far as the legalization or changing the age from 18 to 21, and that ideally we will have a licensing system, just like alcohol with the ABC board. And then Karen Education Alliance, they provide a lot of preventative and early intervention. Oh, thank you, Anne, for adding those in. Resources locally, right? So saw Persia's on the call. Thanks, Persia. They go into the schools and they do different types of presentations and programs for adolescents, professionals, and for parents. And you can access all of those descriptions on that link as well. I think that's probably all my time. Do I have any questions?
So I don't see any questions at the moment, Virginia, but we'll do a Q&A at the end. So
Okay.
I want to encourage everyone right now to go ahead and enter any questions that come to mind as our guest speakers are talking, and we will moderate a Q&A at the end. And now we're going to let Mr. Delton Russell take it from here. I guess we're going to let Shelby Holland take it from here.
Hi, everyone. Good afternoon. My name is Shelby Holland. I do work with partners. I'm the tribal liaison. What that means is work with all tribal members in North Carolina. We do cover only 14 counties, but just working to fill gaps in Native American health disparities. So that's my role. So today I will be talking a little bit about traditional versus, can we go back real quick? Traditional versus commercial tobacco. I am an LCSW, a licensed clinical social worker. I'm also a member of the Lumbee tribe. I do want to put a disclaimer out there that I am one Native American, talking about my experiences and my education. So if anyone else has different experiences or knows more, please put in the Q&A. Always down to learn. And with that, we can go ahead and go to the next slide. So commercial tobacco is known as modern day cigarettes now. Traditional tobacco, I put pictures so you can see the difference. The traditional tobacco is going to be smaller. You can't really tell in this picture because of the angles, but they are smaller and they contain 9 times more nicotine than the commercial tobacco. This is very sacred within Native American communities, and I'm going to get into why they're sacred. We can go to the next slide. So we have things called pipe ceremonies and smoke rituals. Pipe ceremonies are typically held at the beginning of large gatherings, whether it be like an event or negotiation or something like that, or a powwow, something. It's important because it builds communal and interpersonal strength. Most pipe ceremonies include an offering of the pipe smoke in all 4 directions to the sky and to the earth in acknowledgement of the 4 elements. I have a video. I'm going to get into that a little bit later. So each person in attendance takes their turn to either blow smoke from the sacred pipe or wave it around their body in order to ask for guidance and protection. Importantly, tobacco smoke is typically not inhaled during the pipe ceremony. So you see blow is in bold. That was just to show that we are not inhaling. It is a matter of blowing smoke to make sure smoke is in the air. With our smoke rituals, it's very medicinal. And it doesn't always include the pipe. Sometimes you'll see, I'm going to have pictures on the next slide, but don't move forward yet. But it's not always pipe. We can sprinkle over flour or place on hot coals. Sometimes people will put it on water or in the ground. There's just different ways. The reason that we do this is the smoke that's produced is to connect us to the Creator. It's known to cleanse people or cleanse objects. It's also, I think on the next slide, you can go ahead and move forward. We also use it for prayer. That 3rd bullet. So we use it for prayer. It's known to say, if you have a prayer, you have smoke, that smoke is going to carry that prayer up to the Creator. So there's religious means and spiritual means for smoking in my community. Again, used for cleansing. We also gift it to people to express gratitude. In that last picture, you can see smoke coming from his hand. He is thanking the Creator for the food. He was able to catch food. This is not an actual photo, but just a representation of back in the day when we used to hunt ourselves. We would thank Creator for allowing that to happen. The reason that we hold tobacco so close in the culture is because it's thought to be the first plant ever given to us, ever given to the Native people by the Creator. So we hold it near and dear. Again, it can be burned in a pipe, dish, shell, or fire, connecting us to the Creator and carrying prayers. And so I did want to note, you can see the first picture, that's the pipe that I was talking about. She's going to be blowing out of it. It will then be passed around to everyone who is participating in whichever ceremony they're doing. The second person is the smoke is happening and she's putting it around her body. That third picture you guys will see, I'm sure that's more well known. That's what sage looks like. Like people will wrap their sage and do it around their house to cleanse their house. And then that fourth picture is a picture of fire. So the tobacco has been sprinkled in the fire, and that's a picture from a powwow where traditional dances would then take place. We can go to the next slide. I'm gonna share my screen because I have oh, yes, thank you. I have a video that I want you guys to see. Let me make sure this is full screen. Okay. One second.
Traditional use of tobacco in Aboriginal cultures. In Aboriginal cultures, sacred tobacco is mostly used as an offering and as a way of talking with the Creator. Traditional tobacco has been used by many Aboriginal people to pray, give thanks to the Creator and Mother Earth, communicate with the spirits, purify the mind, and heal the body. Ceremonies and traditions where tobacco is used are numerous and vary from one culture to another. Tobacco smoke rituals. The most common traditional use of tobacco is to burn it in a ceremony. Tobacco leaves are smoked in a pipe. Tobacco leaves are burned on coals or thrown on a fire. Smoke is waved around people or objects. In all of these instances, tobacco smoke is not inhaled. The tobacco is burned to connect with the Creator. According to the ritual, other natural sacred plants are also mixed with tobacco. Cedar leaves, sage, sweetgrass, pine or juniper needles. Sacred tobacco without the smoke. In certain cultures, tobacco leaves are offered without burning them. For example, one can ask for protection or assistance by placing tobacco leaves on the ground, on the water, or near rocks, trees, and sacred places. Tobacco is offered this way as a symbol of respect and gratitude. Worn on one's body or hung in the house, tobacco also keeps bad spirits at bay. Tobacco may also be offered as a gift to an elder as a sign of thanks and respect.
Tobacco is very crucial to us.
This gentleman is talking about his experience. I am going to kind of skip forward a little bit just for sake of time.
The pipe ceremony. The pipe ceremony is an important ritual of sharing and gathering. It is often conducted at the opening of an event, a meeting, a negotiation, or a gathering. Pipe smoke is offered in all four directions, then towards the sky and the earth. It is an understanding of the four elements, the earth, air, fire, and water, what our world is made of. Everyone present takes a turn blowing the smoke or waving it around his or her body to create a sense of unity with the Creator and creation. According to the tradition, the ritual's purpose is to ask for guidance in projects, protect the well-being of individuals and the community. Tobacco misuse. While tobacco is sacred, the non-traditional use of tobacco, with its high content of nicotine, is addictive and harmful. Aboriginal elders maintain that this type of use is disrespectful of the spiritual, medicinal, and traditional use of tobacco. The recreational use or misuse of tobacco is any use of tobacco in a non-traditional way. For example, smoking cigarettes, chewing tobacco or snuff, smoking non-traditional tobacco in non-sacred pipes, or smoking cigars. There is an important distinction between the traditional and non-traditional use of tobacco. Traditional use is respectful of Aboriginal customs and uses pure dried tobacco leaves. Non-traditional tobacco use is dangerous and harmful, and the tobacco is manufactured with chemicals.
I will not use this in my pipe for any reason.
Okay, if we could get the slide back up. Perfect. So I wanted to share that because you're able to kind of see, instead of me just telling you what it is, see a little bit about the ceremonies and what that looks like. It is Native American Heritage Month, if you didn't know. And when I was asked to present, I normally present on the disparities. And unfortunately, alcohol and smoking is high in the Native American community. But because it's Native American Heritage Month, I did want to put a positive spin on it and just let you know that sometimes distinguishing between commercial and traditional tobacco is super important, because simply saying live a tobacco-free life is not inclusive to all cultures, and to just be mindful that tobacco is used sacredly within different cultures. Here's my contact information. I know we're doing a Q&A at the end, and I'll be here if you have any questions. Thank you, guys.
Thank you, Shelby. So the next person you will hear, the next voice you will hear will be Delton Russell, and he'll give you some more support and resources in reference to smoking.
Hey folks, so just out of curiosity, to kind of piggyback on what Virginia was talking about earlier, does anybody know why there is a movement to move the age from 18 to 21 to legally purchase commercial tobacco? See, that's a great question that if you have an answer to, put it in the Q&A. We'll talk about it later. So hey, over here at Partners, we've got a program called Living Tobacco Free. As we mentioned, as Stacia mentioned earlier on, we don't actually provide services here at Partners, but what we do is we manage providers that do provide services, right? So we've created this thing called Living Tobacco Free, and what Living Tobacco Free does is it encourages, supports, and equips not only tobacco users, but also our providers in helping our members stop smoking or to avoid it all to begin with, right? So we are working with all of the providers that we have in our entire catchment area. And we're giving them education and information and resources and so on and so forth that they can utilize to assist people in the community that receive behavioral health care services through them, and finding ways to stop smoking. Now, this is incredibly important for a variety of ways, for a variety of reasons. One, I'll share with you guys, I'm a person in long-term recovery myself. And I remember when I very first got sober, being told not to quit smoking at the time that I got sober, right? And I was like, well, that doesn't really make much sense. Kind of seems like you'd want to do both at the same time, just get it all done and over with. But I was told one thing at a time because I can only handle so much, right? Well, as it turns out, years later, we've got studies and data show that it's actually incredibly beneficial for a person to quit using nicotine whenever they first get sober. In fact, it actually increases their likelihood of sustained sobriety by 25%, because it increases the likelihood of them experiencing what's called neuroplasticity. Neuroplasticity is the brain's ability to create new pathways, right? So when Virginia was talking earlier about how we feel irritable and stressed when we're using nicotine, or when we're detoxing from nicotine, so to speak, that irritability and that stress, we can often find pathways to find what's the word I'm looking for? Sustainable ways in coping with that irritability and stress, and that creates neuroplasticity. It's the new pathways in the brain. But anyways, you can go to the next slide. In addition to that, the big thing that we want you guys to know about is that Tailored Plan, this all goes live April 1st. So as of right now, we're gearing our providers up to to be ready to give this information out. In fact, a lot of our providers are already doing this work, but it's not mandated yet until April 1st. When April 1st in 2024 hits, that's when that's our go live date. And if you're interested in learning more, this link here at the bottom of the page, that is what's the word I'm looking for? You can click on that. Sorry, I'm having a tough time here. You can click on that, and that will take you to resources for trainings and information. Click on the next slide. As Virginia had mentioned earlier, Breathe Easy. Breathe Easy is really geared specifically towards people that live with intellectual developmental disabilities, substance use disorders, and or mental illness. This kind of thing is really important, that we start to address tobacco use in these areas. For example, historically speaking, we know that people with mental illness often have a life expectancy that's around 20 years less than somebody that doesn't have severe persistent mental illness. And a lot of the reason for that is because a great deal of people, those of us with lived experience, a great deal of us smoke cigarettes because a lot of us have experienced trauma, and smoking cigarettes becomes a maladaptive cope mechanism that we adopted earlier on in life, and so on and so forth. We've already talked about all that, but all the same, it's Breathe Easy is specifically directed towards people with lived experience, right? If you click on the next slide, for folks that live in the community that maybe don't have lived experience, the Quitline NC is really their direct option. So, Quitline provides free smoking cessation to any North Carolina resident who needs help quitting commercial tobacco use, which includes all tobacco products offered for sale, not tobacco used for sacred or traditional ceremonies, as we were talking about before with Shelby. Quitting coaching is available in different forms, which can be used separately or together to help any tobacco user give up tobacco. So the great thing about these programs is they have coaches that you can get assigned to that'll work with you. It's not like you call and you talk to them one time and they hang up the phone and that's that, see you later. You can actually become part of their program, and you have a coach that you can work with on a daily basis that can help you with smoking cessation. And I think that's my last slide. Is there one other one? Nope, that's it. All right, guys. Well, thanks for having me. And if you have any questions, please feel free to ask anything that you got. I'm super laid back, open-minded, and easy peasy. So you can ask me anything that you got. Otherwise, you put it in the chat and we'll get to it at the end. Thanks.
Thank you, Delton. We did have a quick question for you. Ready for it?
As always.
Okay. While traditional tobacco may not contain the additional chemicals in commercial tobacco, is there any research on the health implications on utilizing it?
Well, I'll tell you this. I'm not a doctor, but I've always been told that inhaling anything is anything other than air is, not always best in terms of health-wise. The tobacco that's used in ceremonial use, Shelby, by all means, please feel free to chime in, but it seems to me that it's used in sparing amounts. It's not something that's used regularly, continuously every day. So if the person is asking, is it safer to use ceremonial tobacco on a daily basis than it is to use commercial tobacco on a daily basis? Again, I'm not a doctor, I can't speak to that, but I will say that from a harm reduction standpoint, inhaling the thing with the fewer chemicals is probably safer in some capacity or another.
Yeah, Dalton, I'll kind of jump in. It is exactly what he said. We can't differentiate right now between the effects of traditional and commercial tobacco, because in the Native American community, I can really only speak to the Native American community because we are using both, unfortunately. Like if we were just able to do studies on people who only are using traditional tobacco for ceremonies. I don't see that being, I don't see the health issues being very high there because again, it's not a daily usage. It might be monthly. And again, it's not inhaled. So there's not research out there that I know of about it, but something that I can definitely look into. And if you're interested in more information, please drop your information in the Q&A and I can follow up with you.
That's a great question, though. Appreciate you asking.
Thank you. I want to first thank everyone for, oh, wait a minute. We got another question. Are vapes used to get other substances, specifically more lethal and dangerous? That's a question for all.
I'll speak to that, and I'm sure Virginia probably has some perspective on it too. Vaping is definitely long since been common with THC users, but I do not know of anybody, any other drugs being synthesized to be able to be vaped outside of THC. And of course, nicotine. But Virginia, do you have any perspectives on that?
I know this is about a year and a half ago, I think. I know I heard about a kid in Chapel Hill, I think at East Chapel Hill High, that overdosed. There was fentanyl in his vape. He was not seeking that, it didn't sound like, but there was a report of an overdose there. And that's one thing when working with adolescents and adults too, but hopefully we have some life experience to know a little bit better. And we can legally purchase things from stores that have regulated products, as opposed to kids who are buying things off like Snapchat and things like that. So trying to be very upfront with adolescents, and like that you don't really know sometimes what you're buying if it's not regulated and doesn't have a barcode, or someone somewhere is not checking that to make sure that what it says is in there is actually in there. You're just buying it off of a buddy, your plug, your whatever, you always run the risk of there being something other than what you intended, which might just be nicotine. But I mean, there's melatonin vapes, so.
And to Virginia's point, some years ago when we started seeing a lot of kids getting sick and some kids actually dying from vaping, they weren't actually vaping, I hate this terminology, vape juice, whatever that is. They thought that they were getting THC, but what they were actually getting was vitamin E oil, and it caused some pretty severe upper respiratory issues, and leading some folks to actually death. But to Virginia's point, historically speaking, if it's not regulated, who knows what's in it? For that matter, even if it's regulated, who knows what's in it? But especially who knows what's in it if it's not regulated.
Yeah.
Right.
If you're buying something from a website and they don't ask for even your date of birth, that's a red flag.
That's for anything. That's for anything.
Right. For anything, yeah.
For anything. I want to thank the panelists as well as the participants for engaging with us today again on this Tuesday afternoon. The one thing I wanted to discuss, and as we close out, I know we're almost short for time, I wanted to make sure that you have the information to contact us. So let's say there is something that you need some form of support, and you weren't able to ask your question, or it might be anything in reference to any services that partners provide. First, we have our, we have our member engagement department, which is for member-specific services, and as well as general questions, specifically if you are not in services. And that number will be dropped in, but it is 704-884-2729, as well as you can email us 24/7, 365. I cannot promise that someone will respond to you at 1 a.m., but you will receive a response within the next business day. And that is at memberquestions@partnersbhm.org. If you have any questions or concerns about services, please give us a call to our Access to Care at 1-888-235-HOPE. And that is 1-888-235-4673. And the last, I wanted to just talk about our member and recipient call lines. As I stated before, The member and recipient service for member and recipient services, we have 1-888-235-4673. And that behavioral health crisis line that I spoke about, that is imperative. That's for anyone. You don't have to be a member. You don't have to be, connected with partners. Give us a call here at 1-833-353-2093. And again, that is 24 hours, 7 days a week. Last but not least, we have provider services, and that's specifically for provider questions and needs. That number is 1-877-398-4145. And again, I would like to thank everyone for spending your lunch hour or your time with us to get this information that we so need. So with that, I'll give you your afternoon back. Thank you and see you next time.